learned tonight. Thank you so much, Ken, for being here. We appreciate it.
Well, I'm glad to be here one more time. So, hi, everybody. If you've been to the other two, welcome back. If it's your first one, it's good seeing you for the first time. Boy, oh boy, we all been shut in long enough. So we started off talking about walking and getting your cardiovascular system going, getting your heart going. And the second one, we started talking about strengthening because we've been getting weak. We haven't been going to our usual events. And actually, you know, I've had a few of my patients that I've seen over the years. This is an interesting thing. What's happened is their exercise was getting out and going to bridge, going to a lot of the social events. And now that they've been sitting at home, oh my gosh, they're having trouble getting out of a chair. They're getting really weak, and they've come in to see me because they're not fearing coming in anymore. We're open, and boy, we've been getting them on the program. So now the next thing is we've been sitting around watching Netflix and trying to find one more series to get through, and we're getting stiff. So if you've entered that age where, you know, you get up out of the chair and you start saying all the vowels like A, E, I, O, you know, getting out because those knees and those hips and that back are feeling the way they are. Now the thing is to work on is flexibility. So the three main types of classes of exercise are the cardiovascular, which was the walking. That was the first lecture. The second one was strength. We got to get our strength up because we need those muscles to move us around. But boy, if we're getting stiff and cramping and whatnot, we're going to be working on flexibility. So going on to the next slide, Guillermo. So our objectives today, what we're going to talk about, explaining the benefits of flexibility, explaining the anatomy of stretching, what it's all about, presenting a variety of flexibility systems. What are you going to use to gain flexibility? And explain mobility versus flexibility. They sound the same, but they're a little bit different. And then show examples of stretching exercises. So I'm going to take you through. So if you got some space there and you want to follow along, I'm going to be doing some exercises with you. If you're compromised at all, or there's certain things you know are going to cause you pain, you know, don't do it. I'll remind you of that when we get over there. So let's go ahead and go to the next slide. So the benefits of flexibility, what does it do? You're going to see this list is similar to the strengthening one. If you want to decrease injury, the more flexible you are, it decreases your risk of strains and sprains. And strains and sprains refer to what tissue are you tearing when you injure yourself. So a strain is going to be in a muscle, and a sprain is going to be in a ligament. So the more flexibility you have when you go through motions or even having falls and things like that, you're less likely to injure yourself with increased flexibility. Decreasing pain. Anybody get cramping at night or just stiffness, like I say, getting out of the chair? That's how flexibility is going to help you there. And then improving posture and balance. I got a nice slide to show you that. And then the relaxed state of mind we'll talk a little bit about, and improving your physical performance. Let's go ahead and go to the next slide. So decreasing injury, where have you experienced injury? For some of you, mature athletes out there, you've been still jogging, you've been hiking, playing pickleball is so popular in the desert now. You name it, there's just so many things people have tried. And if you're very stiff and you notice you try to make a move that maybe in your 20s you never had to think about, all of a sudden you go for that ball that's going just outside the line, and then all of a sudden you feel the pop, or you feel like, oh, I've just pulled my muscle, and that's where the stiffness, and of course we need flexibility to prevent those injuries. Chores around the house. So are you a handy person? You're getting up and down a ladder. And if you're doing that, you know, have you ever been on the ladder where you're on that third rung, and then you got the little impact driver or the electric screwdriver, and you're out here like this, reaching over like this? And again, when you're 20 or 30, not a problem, but you just had to go a little bit further to get that screw and put enough pressure on it, and there goes your wrist. Or, you know, some people get that tennis elbow on the side there. So sometimes trying to do those home projects, like you've always been able to do them, all of a sudden you're doing them and you're getting strains and sprains. Pushing, pulling, lifting, or carrying. This is what humans do. So when you think of all the stuff you do in life, if you're using your hands and your legs and your back, you're probably pushing something, pulling on something, lifting, or carrying. And especially, and what I should have added was reaching. So when you talk about flexibility, when you're trying to overreach to go get something or make something happen, that's when the strains will happen. A simple motion like reaching into the back seat of your car. The reason I add this is a number of my patients, this is how they tore their rotator cuff. So for anybody out there that's had a rotator cuff tear and a repair, you know you would really have not have wanted to have gone through all that. So you don't want to be that person if it hasn't happened to you yet. So here's a bit of advice for you, just from a flexibility standpoint. It doesn't matter even if you're flexible. If I'm driving my passenger or driving a driver's seat, right, and I'm behind the my laptop bag or my hiking pack or whatever, some weight would go back. If you want to tear your rotator cuff, just back with a nice straight arm, grab something heavy and try to pull it forward. So we get to a point in our lives where that.
Ken, we lost you.
There we go. Okay, looks like Ken is frozen for the moment. Guillermo, do we? Oh, wait, sorry for the interruption, having technical issues.
Yep, I'm trying to reach out to Ken, so please, everybody, stay in.
Hang in there. Sometimes at this time in the evening, too, I've noticed that the internet is a little bit weaker, and it tells me that it's unstable on mine a lot, where it freezes my face, but you can still hear my audio. Unfortunately, his audio cut out, or we could just be looking at his frozen face and listening to him. So hang in there.
Yeah, it must be an Eisenhower where they are, because I don't see Kathy either, so they might have any internet issues. Just hold on for a second, please.
Hello.
Back again.
I disappeared.
Do we have you back, Ken?
Yeah, I'm back.
Okay, I'm trying to see where I see you. Where do I see you? There you are. Okay. And I don't know if Kathy's back yet, but we lost you both.
Oh, darn.
Oh,
So,
lost Ken.
Uh-oh. Can you hear me?
yep.
Yes.
You can't see me.
Yeah, Ken, you need to activate your video. You only have your audio right now.
Oh,
Let me see if I can. Okay, hold on. Let me help you from here.
This is our first technical difficulties on this, so
oh gosh.
that's pretty good.
Start video.
Yep, you're back.
Hey.
Yes, you're back. Woohoo!
All right.
Sorry
Life in
about that,
cyberspace.
everybody. Yeah.
No
Either
worries.
pushing, pulling, lifting, or carrying.
So that
Yeah,
all
they got
tells that we're really on real life.
This is how live shows work. 1 minute you're there, next minute all heck breaks loose and you got to bring it back. Okay, so here we are. We were talking about the rotator cuff.
Back seat.
That's right. It was the nightmare rotator cuff tear. Exactly.
Yes, the back seat.
So if you're reaching back to go grab something and it's heavy, that's how you tear a cuff. So what I do, even at 53, is I'm going to wait till I stop my car, go around, open the back door, and get the item. So I no longer grab there because I'm at that age where I'm going to tear that cuff. So we don't want that happening. So flexibility, even if you are very flexible, decreased risk. But the problem is as we learned with strengthening, is as you get older, your tissue becomes more fibrous. So even though you can be really flexible, you can still tear it. So that's where you want to be careful with that. So picking up something off the floor. And also if you go to Costco and you're trying to get that flat of water down on the bottom part because you got stuff to go in the basket. So if you're not flexible and you're trying to carry that heavy thing, which can weigh up to 35 pounds, and put that on the bottom and then pick it back out to put it back in the car, you're going to want that flexibility to pull that off. Very good. Going to the next slide. The other way. So decreasing pain. So do your neck and shoulders ache with jobs requiring prolonged positioning? So like sitting in front of the computer, doing a Zoom thing, or just, you know, doing your books, doing your, maybe you're watching TV. Some people, especially the college kids these days, they watch their TV off their computers. So you can imagine their postures when they're doing that. So if you're getting neck and shoulder pain doing that, there's probably some stiffness involved because you're spending a lot of hours in front of it. And then doing crafts requiring you to focus on fine motor movement. So if you're a crocheter, a cross stitcher, quilter, any of these things where you're really having to focus and get your eyes nice and close to the thing, your head's forward like this, and you're going to get some stiffness through your neck and your shoulders. For the readers out there, if you're sitting there, I get a number of patients that do hours and hours of reading. They just love it, but then they get the stiffness in the neck and the shoulders as well from that prolonged static positioning. Does your back ache with prolonged walking or standing? So sometimes that's weakness. Sometimes that's your hamstrings are too stiff, your hip flexors are too stiff because of too much sitting, watching Netflix, things like that. So do you feel stiffness when you first get up from sitting or lying? This is a really common thing as we get older. If we're over 60, over 70, we started to get that osteoarthritis. I don't love that term. So when you're going to get up, the longer you sat still, you notice, hey, it takes me a while for my body to warm up. And then if I'm doing a lot of sitting and I haven't been stretching, then all of a sudden, hey, I used to be able to pick something off the floor. All of a sudden now, when did this happen? Now I can't. I don't have that range of motion anymore. So when you leave it too long and you lose that flexibility because of the age-related changes, you know, this is why we need to be doing flexibility consistently during the week. So, and then do you have excessive cramping at night? So if you're having excessive cramping, yes, there's issues with electrolytes and dehydration and diet and things like that. Remember quinine, the doctor used to just tell you to take quinine pills and get rid of the cramping. Well, guess what? If you just stretched regularly, that would probably alleviate 90% of it. Sometimes it is related to dehydration. We're at 106, 108 during the day. If you're not drinking enough water, that's why you're cramping. You could be a ballerina and still cramp if you're dehydrated. But if you are well hydrated and you got a good diet, most likely you're too sedentary and you haven't been stretching. So if you got cramping and you want to alleviate that, this is going to be the thing to do. All right, next slide. So when we're looking at posture, we looked at this same thing when we were doing strengthening. Weakness in your core sets this up, but also prolonged positioning in poor positions over time, those tissues will shorten and get used to being in that position, especially the guy who's got his neck forward and his shoulders rounded. When you ask that guy to straighten back up, all of a sudden he can't do that anymore. So some of that's related to the weakness, but it's also related to stiffness. So you see why the 3 lectures, you got to all of them tie in together. But today we're talking about flexibility. Going on to the next slide. So improved balance, again, when we look at this, if you look at the lady on the left who's using the walker, if she habitually is now, maybe she's got diabetic neuropathy in her feet and she's not getting off that walker. That's what keeps her from falling. But you look at her posture when she walks, she's going to get really stiff by doing that posture. So that's going to give her back problems, neck problems, shoulder problems, and so on. So if some of the age-related changes for her are related to flexibility, we're going to try to get her stretched out so she can straighten up more, and then it'll help her balance the forces of gravity a little bit better, and she won't feel so achy. It doesn't solve all the problems. It's taking some of the pressure off to address some of the problems to decrease pain and that stiffness feeling. And then, of course, the person on the right, they have to have the flexibility to hold their arms up overhead and stand on the one leg. But, you know, even looking at them there, if you look for the symmetry, you look on the arm on the left, it's a little closer to the ear than the arm on the right. Now you're acting like a PT. You notice, hey, wait a minute, why is that right shoulder not able to straighten as much as the left shoulder? And then lo and behold, you find out maybe they had an old rotator cuff repair. So sometimes through flexibility, you're trying to balance yourself, you'll be off balance because something's been injured, has some scar tissue on it, and it's never going to get back to the way it was. So then flexibility is your guide to try to get as close as possible to try to get yourself in a better state of fitness and comfort. Go to the next slide. So improved state of mind, I just grabbed this off the internet. I thought it was clever. Problems aren't solved, they dissolve as you evolve. It rhymes, so it's fun that way. But the one thing you notice with going to yoga and things like that, there's always a meditation component. And that's the one thing I find, and other people I've talked to, when you're stretching, there's, people call it a release. There's this basically a release of tension. And then if you're in a state where, say you've got a lot of stress going on, you know, you've had a major move, you've had a major job change, and that's really common these days, right? Or job loss, unfortunately. There's a lot of stress, loss of a loved one, things like that. And you find out, what do you do when you're stressed? Well, you get tense and you hold things kind of tight because things are bothering you. Well, when you're stretching and you release that tension, all of a sudden it's like a big sigh and it just lets go, and you lengthen those muscles and your body feels better, then your mind calms down a little bit. Doesn't answer everything, but it's a component. It's one of these things that helps. So that's what the flexibility does for that. Go ahead and go to the next slide. So improve physical performance. This is what I was saying with at least the pickleball players or the tennis players. If you're trying to go for that ball that's just outside the line and you're really going for it and you overextend yourself, yeah, that's fine when we're 16 to 26. And then when you get over 30, all of a sudden we can still do it, but like, why did I strain myself? It's like, well, because your tissues changed. It's gotten a little older. And then we've got our 60 to 90-year-old group that are still playing tennis and pickleball, which is awesome. And then you find out that, you know, I get some guys and ladies telling me, yeah, I don't go for those balls anymore, because they've learned that what happens when they overextend themselves, that's when the strain or the sprain comes. So flexibility can decrease your risk for that strain or sprain. It can't answer all of it, but definitely if you're really stiff and you have that aggressive, competitive nature, you're, you know, the weekend warrior type of thing, that's where you're going to get more injury. So flexibility is going to decrease your risk for that. The hiker, you know, you look at what they're walking on, this thin little board, and if they're looking at the, you know, yellow warbler they haven't seen and it flies by and they turn their head and their ankle goes off the side, well, with increased flexibility, they'll have the ability to turn their ankle a little bit, then they'll recover it because there's that play in the system. And on someone who doesn't have that extra flexibility, they bend their ankle, the ligament tears, there's the ouch, and then they'll fall onto the ground. So that's the advantage of flexibility for physical performance. You get better recovery because you have better control over your body in those situations. Going to the next slide. Any questions on any of that so far?
Well, I had one that I put up there, which is, what is excessive cramping? Because, you know, if I stretch in my sleep almost any night and I flex my foot, oh, I can start to feel it cramp and I have to unflex. Is that excessive, or?
The toe one is so common, and I get that myself. So if I'm working in the backyard on a 100-degree day and I get a little dehydrated, if I just bend my toe too far down or I pull it too far back, it'll set it off. And you know how extreme they can be. But if I'm, let's say I've had a long day in the backyard doing that and I ditch my stretching before I go to bed, for sure, I'm going to cramp. If I do my stretches consistently in the morning and then I do them at night, then I don't get the cramping. So when you talk about excessive cramping, it's an interesting term. You're always curious in anything medical of what is the source. So you kind of have to iron things out of, did you drink enough that day? Was your diet good that day? Are you skipping meals and trying fasting? And, you know, messing with nutrients that you might need. So the thing to try first would be to go through the flexibility regimen and see if that solves it. And if it does, sometimes in medicine, we do things by diagnosis by exclusion. It's like, well, let's put this to the test and see what happens. And if you got better, we were right. And if you didn't get better, that's not it. Go to the next thing and then try to figure out what it is.
Well, since I don't stretch before I go to bed, maybe that would be a good start. There is not a question here, but Scott had said that I guess the picture that you were showing of that trail was the trail to Mount Whitney from Whitney Portal.
Awesome. That's something I got to do. That's a bucket list thing for me.
And then he said, oh, sorry. Then he said, how long do you hold the stretch?
We're going to get there. That's a very good question. It's 30 seconds, so you'll see the slide and it'll come up again. But yeah, you got to hold them 30 seconds. If you don't hold the stretch 30 seconds, the muscle won't change. Very good. Any other questions? Good. All right, so going on the anatomy of stretching, this will come into the 30-second rule. When you look at muscle, and we did this with strengthening, so just a little review. So if you look at onto the left, you see where the bone is. And then you look at the white tendon that's off the bone that goes to the red muscle. So muscle is attached to the bone through a tendon. So when you look at muscle, muscle has a coating on the outside called the epimysium. We don't want to get too far into this because we're not doing cell biology today. We have muscle bundles that are called fascicles. And inside of the fascicles, inside those bundles, there's muscle fibers. And inside the muscle fibers, you have myofilaments. And those are the things that contract on each other. So you'll have the muscle, you know, when it starts to bulge. This isn't impressive, by the way, but what you notice is that when you flex a muscle, it shortens and it bulges. And then when you extend the arm, it lengthens and it gets longer. So those are those actin and myosin filaments. So we'll go ahead and go to the next slide. I think they're there. And those, if you look on the right, the actin is the purpley stuff on the outside, and the red tubular thing on the inside is the myosin. So they slide on each other. So when you see a muscle contract, you watch those actin and myosin filaments contract over each other. That creates the bulging. And then when you lengthen, that's them pulling apart, and that's a stretched muscle. If you look at the bottom of the slide on the right, it says a stretched muscle. You see the distance between the actin and myosin is now larger than the one in the middle, which is the contracted muscle. So the first one is a relaxed muscle just at rest. The second one is contracted muscle when it bulges, so it's overlapping more. And then on the stretched muscle, it's pulled apart. So that's what this is trying to show you. That's the smallest cell of what happens inside a muscle. So we go ahead and go to the next slide. So you have this thing called a muscle spindle. And what a muscle spindle is, it's a way of communicating from the muscle to the brain on what's happening when the muscle's getting stretched. So when you load the muscle spindle gets activated. It causes the muscle being stretched to contract against you. It creates tension to resist the stretch. Why? Because it doesn't want you to stretch so far that you tear. So the muscle spindle knows what your normal resting length is. And then when you go to extend, it puts a back tension on it so that you have a nice controlled, smooth motion, and that you don't go so hard that you overstretch it and then it pulls apart. So you have this, when you're moving like this, those muscle spindles are going, okay, tension it. Oh, no, relax it. No, tension it. And then it happens at a fraction of a second, and it's so smooth. It's such an amazing machine on how it does this. So when you go to stretch, what do we notice when someone gives us stretches, right? You go to stretch, and the muscle's so tight, you get this discomfort where you don't want to stretch anymore. That's your muscle spindle sending more tension to go, hey, don't go there. If you go there, it's going to tear. It's not going to tear if you're not doing it aggressively. But when you hold it 30 seconds, for the person who asked about the 30 seconds, then the muscle spindle goes, oh, you want me to lengthen. Okay, I'll give you half an inch. So now the muscle gets a little bit longer. So lo and behold, here you are. You can't touch your toes. Well, you start doing stretches, you feel the discomfort, and you go, I don't want to go there. I feel uncomfortable. So I'm going to not stretch more. I don't care about my toes anymore. It's like, well, that flexibility would be good for you. But when you see where I'm going with this is you get the discomfort, so it makes you stop trying. Now, if you know how to control that level of discomfort, you hold that 30 seconds, all of a sudden you're teaching your muscle spindle to let go a little bit more, and then you do it again and again and again, and all of a sudden the stiffness goes away, you get the flexibility, and the next thing you know, eventually you're touching some toes. So as long as you stay patient with it, hold that 30 seconds, things are going to happen in a good way. Let's go to the next slide. Didn't know you had muscle spindles, huh? So now when you look at the anatomy of stretching, we see the arm as an arm. But when you get into anatomy, this is the fun part, is what's the position of the bone? How does the muscle attach to the bone through the tendon? So once you know how it attaches with a point A and a point B. So if you take point A and point B and you pull them apart, guess what? That's a stretch. You're pulling it apart. If you're bringing them closer together to each other, they're on a slack, just like on a rope. If you're holding a rope and you pull the ends together and it drapes in the middle, it's on a slack, so there's no tension. So when you're stretching this, and it's listing all the wonderful Latin names for the wrist extensors, the extensor carpi radialis longus, and so on, if you grab your hand like this and you pull down like that, you're going to feel a stretch right here. And you're getting a stretch exactly where the anatomy is showing you in the picture what you're stretching. And the opposite one down there, it's probably a little too small to see. She's going this way and she's stretching the flexors. So she's stretching the opposite side. So when there's 585 muscles, depending on what you read, 206 bones. The muscles attached to the bones. So that's what we get to do when we're learning, is figuring out how these muscles attach to the bones, in what direction, what movements do they cause. So when we give people a stretch, we got to know which position to put you in to actually hit the target muscle that's stiff. Next slide. So then when you're stretching your glutes and your hamstring and your calf, you can see that when you peel the skin away and you look underneath on how it attaches, why this position in a standing position, if you could pull this one off. So for some people, it's pretty hard to balance to pull this stretch off. You can stretch all those muscles. You get a lot of bang for your buck with this one. But you can also do this one sitting in a chair. All right, going to the next slide. You must hold a stretch for a minimum of 30 seconds for the muscle to lengthen. Why? Because you have a muscle spindle that doesn't agree with what you're asking it to do right away. So if you've been sitting for the last 3 months in front of the TV and your knees and your hips are flexed, you know, sitting here like this, right? Everything's bent. And you've, you know, binged the whole Star Wars, you know, movies. How many hours is that? If you go to get up, you're going to say all the vowels, and then you're going to be really stiff. So if you don't start holding those stretches for 30 seconds, you got to get all those shortened muscles to lengthen. So that's why you're doing that, and why the 30 seconds. All right, next slide. So different flexibility exercise systems. What's out there? We've all heard of yoga. I always say yoga is just a 4-letter word for stretching. So the thing about yoga, though, when you do the poses, they're anywhere from 30 to 90 seconds long. So that's why yoga sessions are an hour and a half. There's also chair yoga. So if you're at a point where these positions, there's no way you're getting into these positions, you're going to end up straining everything, then there's chair yoga. There's yoga for seniors at a lot of the senior centers. Everybody can stretch. The question is what intensity should you be stretching at? And when you get to yoga, you see the girl in the middle doing this pose where she's reaching up. Well, if I try to do that pose, I'm going to do probably a quarter of what she can do. I can kind of get there, but I'm so tight in that position, I can't pull off her position. If I'm competitive, I'm going to say, well, if she can do it, I can do it, and then I'm going to push. That's when I'm going to tear something. So never come to yoga class or any class with a competitive mind. You're only stretching for yourself. You stop where you can have a feel where the stretching discomfort is, but you do not push into pain. You do not bounce. You do not try to match someone who's been doing it for 3 to 4 years. You're going to tear something. This is not a place to be competitive. You'll really hurt yourself. But also look at beginner, intermediate, or advanced classes. Know where you're at. If you're at beginner, you go to the beginner. It's going to take a while to get these things to stretch out. If you're more in the senior age and you're like, no, if I go to that beginner yoga class, that's going to be too much, start looking for chair yoga or a simpler version for seniors. Very good. Next slide. Yoga always goes with Pilates. And if you notice, a lot of this, there's a lot of carryover from one exercise system to another. There's only so many ways you can move a human body. So knowing that, it's okay to see carryover in all of them. Everybody markets their own thing because they want to be the gurus on this particular system. So if you're eclectic, you get to pull nuggets out of each one of them. So if you go do yoga for a while, then you go do Pilates for a while, it's all good stuff. So you're going to win no matter what you choose. But you can see on the intensity ones, like this girl doing the V-sit in the middle, that takes a lot of effort to get to be able to pull that off with that form. So again, just knowing where you're starting from and going to the right level. And the next slide. And then Tai Chi. We always think of this one with balance, right? But when you look at the motions, I had someone explain this to me. It's, you know, you're expressing yourself through movement and martial arts. So you're not getting in the ring and fighting with anybody, but the system comes from martial arts. So a lot of the positions are before you're going to make a kick, or before you're going to make a punch, or before you're going to do blocking a punch, or things like that. But there's no opponent. You're just going like a dance. You're going through all of the motions. And when you watch someone who's very fluent with it, it's very graceful. It's got a balance component because of the weight shifting you need to do. And it moves really slow. There's no rapid punches. Everything, you've seen it in Tai Chi, everything is a very slow, fluid motion. So that's why it's got a lot of benefit for people over 50, people over 60, and just another system that's beneficial for that. Next slide. Any questions on any of those systems, or maybe systems you know of that you'd like to share?
I don't see any questions in the chat. People can unmute. I just wanted to let folks know that we have chair yoga on Thursdays on a Zoom. I believe it's at 11 o'clock, but you could check our Zoom things for that. And
Nice.
It is specifically very gentle, very slow. It starts out with the meditation. It's really quite wonderful.
Excellent.
There was a question, Ken. It said, do you lead up to the 30 seconds?
That's another good point. If you're really, really stiff, yes. I have patients where I want to get them to 30 seconds, but there's a term we use in physical therapy called tissue irritability. So if your tissue is really irritable and you hold it too long, you can irritate it and inflame it. So yes, if you get to the 15th second and your brain's telling you, you know, you better bail on that stretch because I really don't feel too good right now, it's better to bail and work yourself up. So exactly, you always listen to your body first. Don't you love it with exercise guidelines? There's always a wonderful guideline that's written, but there's no one there instructing you and telling you what to do with your particular case. So yeah, anytime, I always tell patients two phrases. It's like the 60s. If it feels good, keep doing it. The other one is the old doctor joke. Hey doc, it hurts when I do that. Well then, don't do that. Exactly. So if you have to back it off, you back it off. And if you have to start at 10 seconds and build up to 30, absolutely.
Okay, we have an update that the chair yoga that I should know since it's at the center is at 10 a.m. on Thursdays with Lynn Simonson. So thank you, Chuck, for giving me the correct time. I knew it was around that time. And also Scott is saying active and passive stretch define.
So passive stretch is when I stretch you. So if you come to therapy and let's say you got frozen shoulder or you've had a rotator cuff repair or a total knee replacement, then I'm going to get a hold of your limb and I'm going to stretch it for you. So you're lying there relaxed. I get you to bite the towel or the belt. No, it's not that bad. And then you see what you're just lying there and someone's moving you. So that's passive. Active stretch is when you're doing the stretch. We're giving you the advice on how to position your body and how to move so that point A goes away from point B to put that stretch on the muscle. So that's an active stretch.
That looks like it.
All right, moving on. So flexibility versus mobility. So flexibility is the range of motion in a joint or group of joints. So you can, stretch your wrist, which is one joint, and then you can add your elbow and your shoulder and do them all together, right? So it's in a range of motion in a joint or a group of joints, or the ability to move joints effectively through a complete range of motion. So here's my elbow all the way straight. Here's my elbow all the way bent. I'm moving through my range of motion, and you're seeing how flexible I am. Let's say I went and strained myself because I was working with the skill saw in the backyard too long, and I got an old clunky heavy one, and I got some lateral epicondylitis over here, and then I go to straighten my elbow, and I'm like, I can only get it that far. I normally have this range, but now it's stuck here. Or I go to bend it, and it starts pulling on my tendon, and I can only get this far instead of this far. So I've lost flexibility. So flexibility training includes stretching exercises to lengthen those muscles to get that mobility back. Let's go to the next slide. So next slide, moving forward. There we go. So flexibility, so those are just some examples, yes. So 1 week after my total knee replacement surgery, I couldn't bend my knee to 90 degrees. It's the same as the elbow analogy I just gave. Or after I injured my shoulder, I couldn't reach behind my back to get my bra strap, which is a real common one with shoulder injuries with my lady patients. Go to the next slide. So mobility, this refers to how freely a joint can move throughout its full range of motion. So muscle length or flexibility, which we talked about, muscle tension and tissue quality, whether it has scarring or it doesn't, and how the nervous system controls the joint. Your nervous system has to fire muscle in a sequence and a certain timing to pull off a move are all part of mobility. So you can have flexible hamstrings, but you may not be able to pick something up off the floor or touch your toes because you don't have the ability to control your core to pull that off. But you could say, oh, my hamstrings are tight, I can't go to touch my toes. And it's like, your hamstrings are fine, you don't have the control to pull that off. So that's mobility, putting it all together. Go ahead and switch to the next slide. So some examples also from sport, common in the desert, right? My tennis serve is weak because I can't reach back far enough with my stiff shoulder. So instead of, scratching my back, which my old tennis coach used to tell me you have to start off with the serve. If I've had a problem with the shoulder and I can only bring it back to here, I lose all of that range that I can use to develop some momentum to fire that ball faster. So if I want to improve my performance, I'm going to need that flexibility back. And then my back and hips are stiff. That's limiting my backswing and my follow through. So now I lose club head speed. So now I can't hit the golf ball as far. And if I'm going to beat my brother, you know how that goes. So going to the next one. So an important part about stretching, after you gain muscle length and range of motion with flexibility, you have to use that new range to keep it. Otherwise, it's going to return back to the shortened position, which is the old phrase we all know, if you don't move it, you lose it. So if I'm, say, working through therapy and I got my stiff elbow and I stretch it, and so like the passive versus active, I stretch the elbow, I get it back to straight. Patient goes home, never reaches into that range to straighten their elbow again. They said, well, Ken stretched me out. I'll just leave it bent until I see him again. Guess what? Within 2 hours, you've lost that range we just gained because you didn't use it. So if you gain flexibility, you have to use that flexibility to keep it. Otherwise, it goes away. Yes, you have to exercise forever. Sorry. Next slide. So not only do you need flexibility for any level of fitness, but you need strength and stability to improve your overall mobility. So that's where the strengthening and the flexibility come together. Going to the next slide. Any questions on that?
And people can unmute themselves, I believe, to ask the questions. But I don't see any in the chat.
No worries. I can't tell if I heard. Oh, that was me.
We have two people on. Nope, everybody's muted now. Oh, here we've got one. From Chuck. You said that Eisenhower is open for business. How about physical therapy? If my doctor prescribes that I need some help, are you open?
Yes. So at the Vaughn's Rimrock Shopping Center is where our physical therapy office is. We've been open the whole time. So we have all our precautions in place. We take your temperature before you come in. Our aides are excellent. You get off of a bike, they're wiping that down right after you leave the bike before the next patient comes on, and the treatment mats and all of that. So we're following all the precautions we need to be doing here. So yeah, you just need a doctor's prescription to come on in. We'd be happy to see you. The phone number, it's on the front slide. It was 760-770-1650. If you call the front office, the girls will ask for a prescription if you have the prescription, and or if the doctor send it over, and go from there.
We've got, well, Christine just told us it's very helpful information, and so that's always great and affirming to know. And Tom is asking, is there any stretching that would help with the forward neck position?
Yes, so I'm going to get into that when we go through the stretches. So very good question. You read my mind. Go on to the next slide. Look at that. Did you know that that was the next slide? That was pretty good. So the forward head position, where does that come from? Well, this is with the reading, using computers, and this is the life we're in these days. So instead of being like this, what's happened is we started to drift into this. So what you have to do, if you can do it without a guide, just sitting there, is you got to tuck your chin in towards your throat, pulling it back like this. If you have restrictions in your joints, you may not be able to get all the way back to here. So some people will be like this. They'll go back and they'll feel this bony block, and then they think they're correcting, then they'll tip their head back to say, oh, look, I've got it straight. And it's like, no. So I'm going to move over to the wall here. I hope you can see me all right. So I'm just standing here. Can you guys see me okay? I got to tilt it. I'm good? Okay. So if you're like this, you take your chin, tuck it in towards your throat, trying to get the base of your head to the wall. Do not look up to get your head to the wall. You have to bring the chin into the throat like this. If you can't get your head to the wall, you bring the wall to your head. So you grab a pillow or a towel. If it's too big, it'll push you into a forward head posture. So this will be too big for me, but then I push into it, tuck my chin in towards my throat to straighten up, and then I can get a stretch there. So we did this one in strengthening as well, because you strengthen the deep neck flexors in the front, but you're also, when you feel that stretch, if you're doing it right, you're going to feel it right down the back of your neck. It can go down to your mid-back. Yeah. And that's just showing you how stiff that's got. So that's the chin tuck. Very good. Let's go to the next slide. So yeah, if you guys want to follow along with these, feel free. Remember, it's like the 60s, feels good, keep doing it. If it hurts, it's the old doctor joke. Hey, hurts when I do that. Well, then don't do that. Don't be aggressive with these. If you haven't stretched in a long time, you can hurt yourself. So you got to go really slow. The one thing I worry about doing Zoom lectures with trying to teach exercise is I don't know your particular case. I've got people with severe osteoarthritis, rheumatoid arthritis, MS, Parkinson's. They've got a whole slew of things going on. Some people can stretch very easily. Some are really prone to easy tears. So if you know that you can injure yourself, go very, very slowly. If you feel a mild discomfort, that's okay. If you feel a strong pain coming on, back it off and don't do it. If I can't see you, I can't correct you. So that's what scares me sometimes about teaching stretches over the internet. Okay, so upper trap. So this is one. This only works if you can do the chin tuck properly. So if you don't do a good chin tuck, you won't get the stretch on here. So I'm just going to back up a little bit. So if I'm over here, actually maybe I'll use the mat here. The first one's showing you take your hand, you hook it under the mat. If you're not in a place where you can hook it under, you can stick your hand behind your back. It'll work as well. So I'm going to show the hand hooking one. So I'm going to hook there. What this does is it drops my shoulder downward, and that's taking point A and bringing it down. Point B is at the base of your skull. So you've got to tuck your chin into your throat, tilt your head away, and then, oh boy, you're going to feel a nice big stretch along there. And that's your upper trap stretch. My pet flies back. Okay. If you want a little bit more, you can turn your head and look up to the ceiling a little bit. That'll increase it even more. Very
Ken,
good.
can we make you larger like we did that time because you're so small?
I think,
Is that too difficult to do?
I'm not sure if Guillermo can make me bigger from there or if the people at home can do it by clicking one of the buttons on there. I'm not sure which one it is. They can expand me on the screen.
No, he's on the spotlight video, Candace, so this is the biggest.
Oh, right, because he's got the PowerPoint is.
Yeah.
So if you need to bail off the PowerPoint and just go to the spotlight, that'd be fine, and then they can have the larger picture. So that's the upper trap stretch.
Or take it off of gallery view for those of you who are on gallery view.
This is one of the things we've been learning to do here too, is how to get that camera view a little bit better. Am I still too far? So go on to the next slide. We'll just keep moving along. I'll come a little closer here so you can see me. So when you're doing the sternocleidomastoid stretch, that muscle's right here. So if I turn my head to the side, you see this big muscle going along here? That's your sternocleidomastoid. So to stretch it, what that person's doing is he's putting his hand down here to hold this down. He's turning his head a little bit to put the angle of the muscle in the right position. And then he's tipping his head back a little bit. So you're taking this muscle and you're putting it on a stretch. So if you feel a big tug along here, you're doing it right. Then of course you have two of them. So then you turn the head a little to the other side and going back, holding that down, and you'll feel that stretch along here. If you open your mouth, it'll decrease the stretch. If you close your teeth, you'll feel that'll increase the stretch. So opening the mouth decreases it because you're relaxing some of that muscle. And then closing it is, you'll feel an increased stretch if you notice that. And sometimes that's too much information. That's your platysma when you open and close the mouth. It's also going to get stretched when you do the sternocleidomastoid. Very good. Go to the next slide. So posterior delt stretch, if you got some stiffness in the shoulders, then on this one, what you do is she's grabbing the arm on the top and pulling it across. But for an easier way to do it is if you cup underneath. Oh, there we go. And then you pull across this way. So it might be harder to pull it this way. It might be easier to grab it underneath and just pull it across here. And you'll feel it along here. And of course, switching to the other side. Just grabbing this way or this way. And you'll feel it along here. Good. Very good. We can stay here. I've got all these on my little cheat sheet on my phone here. So the next one is a shoulder mid-back stretch. So there's that version. I'm going to show you a different version out here. So you're standing with your feet together or feet slightly apart if your balance is off a little bit. So have you bring your hands together and you make your little gun like that. All right. Your fingers, you're going to go straight up to the ceiling. And you're going to try to bring your biceps to your ears. Now, some of you, when you do this, your shoulders are going to be stiff. Instead of being straight up and down, arms are forward because they're tight. That's okay. Don't force it. You're also going to see windows where you can't lock out like this because you're stiff. So that's okay. If you only get to here, that's as far as you go. If you can go further, you try to lock out and reach here. Remember, there's no competition in stretching. Once you get up here or here, wherever you're at and you're feeling the stretch, then you can go off to the side gently. If you go too far and you've got low back pain or low back problems, don't go to the side, just stay straight up. As you go to the side though, you'll feel a stretch along here. And you're getting some of these mid-back muscles that also attach to your shoulder. And then going to the other side. And back to the center. And then coming down. You'll notice your shoulders will start burning when you're in that position. And that's because they're a little weak. After 30 seconds, I get a little bit of burning there myself. All right, so now we're going to try some knee to chest. So I'm going to put myself on the mat here. It looks like you'll be able to see me there, okay? So the next one, oh, going the other way? Yeah, there it is. So when you do the knee to chest, if you have a hip replacement and you pull this too far, you can dislocate it, especially if it's a posterior lateral approach. People that have hip replacements, they know what a posterior lateral approach is. That means that the scar's on your side of your buttock. If they went in through the front, you can get away with a knee to chest stretch without dislocating your hip. If you've had labral tears or you have osteoarthritis that you feel the pain in the groin, if you pull too hard on this, you're going to aggravate your hip. So do not do that with this stretch. Remember, no competition. It has to feel good. So if you're pushing yourself too hard, you're going to hurt yourself. So as you're lying on your back, you grab your knee. If your knee bothers you when you put pressure on it, you grab underneath the knee and you pull that towards your chest. If you feel a stretch through here, through your back, you're okay. If you feel pain in your groin, you have to back that off. That means that that joint's probably a little more out there and it doesn't like that. So remember, if it feels good, you keep doing it. So I'm going to keep pulling. I'm feeling good. I'm doing okay. I can actually grab on the top. And that's about it for me. So I'm going to hold that there for 30 seconds. And then I'm going to give it a break. And then I'm going to switch over to the other side. Remember, you have to count a real 30 seconds, not 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Everybody does that in here. It's like some of my patients think this is 30 seconds. Don't be that person. Very good. Going to the next one. Now this is the big one. This is the hamstring stretch. These get so tight on anybody who lives in North America as we do way too much sitting. So what you do is you hook the foot with the stretching strap. This is the stretch assist strap. It's got a bunch of loops on it. You can also use a beach towel. You can use a belt. If you don't have that handy, all you have to do is grab behind the knee without any equipment, and then you just extend the leg this way. Now, what a lot of people try to do is they try to extend their leg like this. Well, that will take away the stretch. You want your thigh to be just a little past 90 degrees here with the bent knee. Stabilize it. Don't let it drift. And then unlock the knees, sending the toes to the back wall, and you're going to feel a nice big pull along there, and you've just found your hamstrings. So you're going to hold that for 30 seconds. If you have the stretchy strap, this little bit of pressure helps you to control the stretch a little bit more, and I can add a little bit more to it. You do not pull like you're trying to stop a horse. You just a nice little back pressure to help guide the foot here. And then you'll feel this along here. If you have the stretch assist strap, you can add a gastroc stretch or calf stretch on top of it. So you go into your hamstring stretch, and then you drop your toes down towards your head. So instead of being up like this, you bring it down this way. And then you'll change the quality of the stretch from here to down in here, and you're going to stretch both of them at the same time. Very good. Go on to the next one. Uh-oh. So now piriformis, good job. So this one gets done in a lot of different ways. So you're going to see where people cross over and they grab the bottom one, and this gets really complicated. This one you should do in pieces, where if I'm stretching this left leg, I'm going to bring it up. I'm going to put my left hand, because it's my left leg, on my knee. And I'm going to pull my knee towards my right shoulder. I'm going to start to feel a stretch in my butt. I'm going to take my right hand and grab the shin. And I'm going to pull the knee and the shin over to the opposite shoulder. And boy, oh boy, again, if you got a hip replacement, you can dislocate your hip doing this. You should not do this on the hip replacement side. When you pull the knee and the ankle together, you're going to feel that stretch in the butt right there. That's your piriformis. This is one that gets really, really stiff. I always tell patients that, you know, you pull on the knee, but the ankle's the volume control. If you want more stretch, you pull on that ankle to the opposite shoulder. If you want less stretch, you back it off. And that's how you can control the pressure for that stretch. Very good. Next slide. So this is the quad lumborum stretch. Perfect. So some people call this the $1 million roll, because you feel like $1 million after you get out of the stretch. So you lie on your side. You put your top knee down on the mat. You take your upper body, your top shoulder, keep your elbow at your side. You're going to roll back. And as you roll back, you're going to feel a stretch on the top part of your low back. So in this case, it's going to be my right low back. And that's quadratus lumborum. It's quad means four. So it's got four sides. It looks like a square. It attaches from your ribs to your low back to your pelvis. This is one that's good for golf. Sometimes when you do this stretch, you'll hear a pop. It's called a cavitation. It's like cracking your knuckle. You can pay yourself the $150. You just manipulated your own spine. So it's not a bad thing. If we got a dime for every time a joint made a noise in here, none of us would be working. So if you get a little joint noise when you do that one, don't worry, you're going to be okay. All right, taking the next slide. A calf stretch, perfect. So when you do this one, you need to find something stable to put your hands against. So I'm going to use the wall over there. Nope, I'm going to use this over here. So the key on this one, I got to let you see my feet. Now, I want you to imagine that I've got my hands on something stable like a wall, okay? So my front knee is going to bend like that. The back leg stays totally straight, and you drive the heel into the ground as you lean forward onto that front knee. Then you're going to get the pull back in here. Now, here's the cheat everybody does. When they go into this position, that back foot, it's going to turn out like that. If you turn that out, you're not going to feel any stretch. So you've got to turn that foot so it's directly facing the front. Then when you lunge forward, oh boy, now you found your gastrocnemius muscle or your calf muscle. So if you've been doing this stretch for years and you were going, I keep stretching and my calves keep cramping, it's because you've missed the target because you've turned your foot out. You've got to turn the foot in and get it straight. And that's what's going to get that muscle stretched out. So make sure you're not cheating on that stretch. You guys feeling that? Okay, now we're getting into yoga. So what I want you to see on that slide there is the position of the toes. So you'll notice that she's got her toes pointed. So that, you know, that toe cramping you were talking about earlier? So you've got to stretch the top of the toe and you got to stretch underneath. So when you do upward dog, you can do components of it. So upward dog is very complicated and it's hard on backs if you have a lot of low back pain and you're really stiff. So you may not be able to pull all of upward dog off. So what upward dog is, you put your hands in a V position, you put that underneath the shoulders. And if you look at my toes, I'm pointing my toes and I'm getting those on the floor, the mat. I'm going to push up, which arches my back. And I'm going to get my head out of the turtle shell. Right now, my knees are in contact with the mat. But the full upward dog is you come up onto the toes and my legs are now off the mat and there's some pressure on my toes right now. So if you can't pull this off because of weakness in your arms and you can't arch your back that far, you can still stretch the front of your toe by just doing the one component of, I'm going to lie on my stomach, I'm going to point my toes, and I'm going to try to push the front of my foot down into the bed, and I'm going to get a pull across the front of my foot. And if I roll my ankle a little bit and put more pressure on my big toe, I'm going to put a stretch across the top of my big toe. Don't do it really hard. You got to ease into it. When you hold that stretch, that's going to help to stretch the muscle that makes your big toe cramp in the upward position. Now we're going to switch over to the downward dog. Let's take a look at that photo. So that's where we're going to end up. And then when we watch the transition, when you go from upward dog to downward dog, looks like this. So here's my V. I'm going to push up into my upward dog. I'm going to hold that. Then I'm going to come down. Now I take my toes and I turn them upward. Try to dig my big toes into the mat there. I'm going to go into a plank position, which is like a push-up position. Then I'm going to send my butt into the air, pushing back, dropping my heels to get those calves to stretch. Then I push myself into downward dog. And that's going to stretch the bottom of my feet, my calves, to get rid of the toe cramping that goes downward and then the calf cramping. Then when you transition back, you go back to plank. You lower back down to the mat, point the toes, and then you can go back into upward dog. So you transition between upward dog and downward dog to get those muscles stretched out. So you hold those stretches for 30 seconds. And then you learn, do I do 5? Do I do 6? If you go to yoga class, you're going to be stretching for 90 minutes long. So remember, beginner, intermediate, advanced. Sometimes you do components of the stretch. You don't do the whole upward dog. You only get components of it. For your low back, for example, going back to the upward dog position, we call it prone propping. For some people that are trying to get back extension, sometimes their upward dog is literally just coming up to here. That's all they can tolerate, but they're not doing the rest of it. That's okay. Sometimes we have to break down a stretch into a component, and that's what happens when you come to physical therapy is we have to figure out, where's your pain coming from? Where's your mobility deficit coming from? When you go through the evaluation, we're looking at how you're moving with those 585 muscles and 206 bones. We're going, okay, we got a tight spot here. We got a weak spot over there. Okay, no wonder they got what they're going on. So then we have to now start piecing together, customized to yourself, figuring out, on Dave over here, we've got to get rid of his forward head posture and his rounded shoulders. And on Janice over there, we've got to take care of her stiff hamstrings and her low back problem and so on and so forth. So everybody's unique. So remember, there's an infinite number of stretches and positions you can get your body into. The question is, are you doing the right thing at the right time for the right reason so that you don't aggravate it and make something worse? So that is not a goal for me. But maybe after all these stretches, you're feeling a little more flexible. Thanks for listening today. Thanks for coming to all the other ones. And I hope these have been helpful for you and give you some things to do to help fight this quarantine thing. And, you know, as we start moving and getting out there, you know, getting our fitness levels back, because yeah, it's been scary. A few of my more elderly patients, the shut-ins have really been hard on them. So they've come in weak, deconditioned, some gait instability, you know, walking problems, balance problems, just from weakening. So I'm glad we're starting to open things up and get out there and start moving around, you know, following precautions, wear your mask when you need to, and social distancing and all that. I mean, those are the easy little steps we can do, but we got to, you know, from a PT standpoint, boy, we got to get out of these houses and get moving around, for sure.
Well, thank you, Ken. It doesn't look like we have any questions, but
Okay.
you know, I know I feel better for the little bit of stretching I did along with you. I loved
good.
watched all of our folks, a good number of them were stretching right along with you. I don't know if you could see that.
I saw a couple, yeah.
Yeah, so that's really wonderful. So someone started screen sharing something. But anyway, thanks so much, Ken. We went a little bit over, but I don't think anybody minds doing that. And hopefully we'll see you all next Wednesday, same time, same station. Thank you.
Thank you. Thanks for coming.
Thanks, everyone.